Current Health Agency is not endorsed by the U.S. government, federal Medicare program, Social Security, or any other government agency.
Current Health Agency presenting Tricare for Life and Medicare. Learn how Tricare and Medicare work together. Learn how Tricare and Medicare work together. Tricare for Life is a Medicare wraparound. Coverage for Tricare beneficiaries who have Medicare Part A and Medicare Part B, regardless of age or where you live. So Tricare for Life, TFL, provides comprehensive health care coverage. You have the freedom to seek care from any Medicare participating or Medicare non-participating provider or military hospital or clinic if space is available. Medicare participating provider files your claim with Medicare. After paying its portion, Medicare automatically forwards the claim to Tricare for processing, unless you have other health insurance. Tricare pays after Medicare and other health insurance for Tricare covered healthcare services. How Tricare for Life works. Eligibility. Tricare for Life is available to Tricare beneficiaries regardless of the age or where you live. If you have Medicare Part A and Medicare Part B, you are eligible for TFL on the first day you have both Medicare Part A and Medicare Part B. Tricare eligibility requirements. When you are entitled to a premium-free Medicare Part A, Medicare Part B coverage is required to remain Tricare eligible if you are an retired service member, including retired National Guard and Reserve members drawing retirement pay, family member of a retired service member, Medal of Honor recipient or eligible family member, survivor of a DC sponsor, eligible for a former spouse. Medicare Part B coverage is not required to remain Tricare eligible if you are an active duty service member or active duty family member, remain eligible for Tricare Prime or Tricare Prime Remote, remain eligible for Tricare Prime, Tricare Para Remote, or Tricare Select option. While the sponsor is on active duty, however, when the sponsor retires, you must have Medicare Part B to remain Tricare eligible. See Medicare Part B or medical insurance later in this video. For information about Medicare Part B special enrollment period for an active duty service member, an active duty family member. You are enrolled in the Tricare Reserve Select, the Tricare Retired Reserve, Tricare Young Adult, or the U.S. Family Health Plan. While you are not required to have Medicare Part B to remain eligible for the Tricare Reserve Select, or the Tricare Retired Reserve, or Tricare Young Adult, or U.S. Family Health Plan, you are strongly encouraged to sign up for Medicare Part B when you first eligible to avoid paying a late enrollment premium surcharge. Note, regardless of your age, an active duty family member who have Medicare Part A may enroll in Tricare Prime if they live in a prime service area or with a drive time waiver within 100 miles of an available primary care manager. TFL is managed by the Department of Defense. Medicare is managed by the Centers for Medicare and Medicaid Services, CMS. The two agencies work together to coordinate benefits. Medicare is a federal entitlement health insurance program for people age 65 or older, under age 65 with certain disabilities, and any age with end-stage renal disease, ESRD. There are two ways to get Medicare through the original Medicare, which includes Medicare Part A and Part B, or by enrolling in the Medicare Advantage Plan, also known as Medicare Part C. Tricare for Life is a Medicare wraparound coverage for Tricare beneficiaries who have both Medicare Part A and Part B. Wraparound means that Tricare will pay for the out-of-pocket costs that Medicare doesn't pay that you are responsible for, without after filing any claims. Medicare Part A, known as hospital insurance. Medicare Part A covers inpatient hospital care, hospice care, inpatient skilled nursing facility care, and some home health care. SSA determines your entitlement to Medicare Part A based upon your work history or your spouse. You are eligible for a premium-free Medicare Part A at age 65 if you or your spouse has 40 quarters or 10 years of Social Security covered employment. Medicare Part B, known as medical insurance. Medicare Part B covers provided services, outpatient care, home health care, durable medical equipment, and some preventive services. Medicare Part B has a monthly premium. Part B premium, which may change yearly and varies based on income. If you sign up after your initial enrollment period for Medicare Part B, you may have to pay a late enrollment premium surcharge, 10% for each 12-month period that you were eligible to enroll in Medicare Part B but did not. Medicare Part C, known as Medicare Advantage. Medicare Part C refers to Medicare Advantage plans which are offered by private companies that contract with Medicare. A Medicare Advantage plan provides all of your Part A and Part B services, and usually vision, dental, hearing, and Part D pharmacy coverage. You may pay a plan premium each month in addition to your Medicare Part B premium. You must get all your healthcare service from Medicare Advantage plans networks of providers. This does not apply to emergency services. You should understand, if you enroll in a Medicare Advantage plan, you will have to pay co-payments at the time of service. Tricare for Life can reimburse you for the co-payments you paid for Tricare coverage services when you file a paper claim. Benefits not covered by Medicare or Tricare for Life. Examples of services that are generally not reimbursed by TFL or Medicare include acupuncture, experimental investigational services, in most cases, eye exam, routine, hearing aids. Note, this list is not all-inclusive. If you are enrolled in a Medicare Advantage plan, you have to pay the co-payment for covered services at the time of service. Tricare for Life will not pay for non-covered services. How Tricare and Life works with Medicare. Medicare and TFL works together to minimize your out-of-pocket expenses. However, there are instances when some healthcare costs may not be covered by Medicare and or TFL. Healthcare services covered by Medicare and Tricare. When you see a Medicare participating or Medicare non-participating provider, you have no out-of-pocket cost for service covered by both Medicare and TFL. Most healthcare services fall in this category. After Medicare pays a portion of the claim, TFL pays the remaining amount, and you pay nothing. Tricare for Life out-of-pocket costs will cover. Tricare for Life out-of-pocket costs table. The type of service covered by Tricare Medicare. Medicare pays the Medicare authorized amount. Tricare pays the remaining amount. You pay nothing. Covered by Medicare only. Medicare pays the Medicare authorized amount. Tricare pays nothing. You pay the Medicare deductible and cost share. Covered by Tricare only. Medicare pays nothing. Tricare pays the Tricare allowable amount. You pay the Tricare deductible and cost share. Not covered by Tricare or Medicare. Medicare pays nothing. Tricare pays nothing. You pay the bill charges, which may exceed the Medicare or Tricare allowable amount. Applying for Medicare or TFL, together we can help you find a plan that will meet your needs. Or to learn more how TFL works with Medicare, go to www.conradihealthagents.com or call us on 224-433-5754. Like us on Facebook or connect with us on LinkedIn and subscribe to our YouTube channel. We're also on Instagram and Twitter.